All right, so welcome everybody back to another episode of Innovators of Health. We are here again with Dr. Kevin Logan from the Logan Institute. Thank you for coming back, Dr. Logan.
Yeah, thanks for having me.
Yeah, since we last spoke, you've had a few months now, probably a lot more experience with using RedVive and finding ways to integrate photobiomodulation into your practice. So why don't we, just dive right in?
Sure. So I think one of the advantages of the RedVive and the reason I'm so attracted to that, I've been using photobiomodulation in my practice for 25 plus years at this point, and all the devices that I've purchased over the years are quite expensive and mostly, well, for in-office use. So that requires the patient travel. They have to take time out of their day and it's expensive. Now, these are different types of delivery systems, different types of devices that deliver photobiomodulation for a variety of effects. But now RedVive has created a product that actually allows patients to use that in their home at their convenience. It could be early morning, late evening for all those the circadian rhythm benefits, but also it just provides them a tool that they can use every day that doesn't require that they actually drive to my office and take time out of their day. They can build it into their own day
Mhm.
and utilize that red light in a much more effective way because it's delivered daily or 5 days out of seven, in a week. And it's just a great tool.
No, that's great. People think in terms of coming to a clinic as the place for treatment, but healing really happens at home. And would you say that this is something that gives you a way to extend your care beyond the clinic into a patient's home?
Absolutely. I mean, people, today, for example, I had a patient and he's having some problems with patellar tendonitis. And I said, we have these devices, these tools here. You can come in. They live an hour away. They're going to have to drive down to my office. He and his wife were both sitting in the room and they're both patients. And I said, look, if you purchase this device, you're going to be able to use this every day. Both of you can use it. You can use it for sleep, for waking up, then you can use it for direct application for pain and whatever conditions that we're trying to treat. They're very intrigued and very excited by that process because one, they have to drive an hour, it's gas, it's time, all those things. Now they have something that they can have at home that's going to be there whenever they need it.
Excellent. So let's talk about that. What do you what do you did you say the same thing that you say to these patients as you do everyone? Do you have a process which by you follow when you're talking to a patient about this? How do you get them to um how do you introduce this to them?
Well, the easiest thing is, I've been using it for so many years. I've used it on myself. I have a device at home. I tell them what I do at home, and then, I've been doing it for so long in the clinic and I have years of experience of seeing improvements in so many areas that it's pretty much a no-brainer to me to tell the patient, look, this is something that I do myself every day, and this is something that could benefit you in so many ways. And then I go through all the various benefits, from pain and inflammation to circadian rhythm. And, they, th- th- obviously you have to experience it for yourself in order to understand the benefits that it has. And once, and I can relate that to the patients, because I do it every day and I have my family do it. And then I can tell the patients, look, this is something that I do. This is like part of my daily routine. And this is something that you can do that's going to help your health for years to come.
No, that's beautiful. So let's talk about that really quick because we always talk about the importance of personal experience first. And I know we covered that last time to a certain extent, but you know, talk to me a little bit about what how your personal experience has been using it daily. Has there been any changes? Is it exactly the same? What are you feeling now?
Yeah, so I don't do it every day, so I'd say I probably do it 5 out of 7 days, but
Hmm.
I start my day with a red light, turn it on when I wake up, and just getting my metabolism going, and then generally I will actually lay on it or lay under it, for the start of my day for about 15 minutes, and that's when I actually do my meditation. I've got it on me. I start my day with energy. So I basically feel like I don't need a cup of coffee. I don't actually drink coffee. I don't need coffee because I'm using the red light and I'm hydrating. And then if I have a particular ache or pain,
Hmm.
I play a lot of tennis, so my knees are, can be a little problematic with all that pivoting and everything. So, I'll often focus that on both of my knees. I might start with the front side of my knee and then turn over to the back side of my knee or the side of my knee, depending on what's going on. But I would say that consistent use is really consistent use is the most beneficial way to actually benefit from the red vibe and the red light.
Hmm.
People that are only using it periodically are not getting the full benefit, and I am very consistent with the use of the red light. Now, my family members, I've offered it to them. They're not as consistent as I am, but I'm also very disciplined, and that's just the way it goes.
So, what have your family members seen any benefits from using it, even you know, even in their experience?
Yeah, so my wife uses it fairly consistently. She's definitely benefited from reduced pain and inflammation from a variety of things. My kids, they've used it, I would have to say, intermittently. And so my one daughter struggles with acne. She has seen some benefit, but she's not consistent, and consistency is the issue. And so I did a little video about 3 weeks ago that we put out on my website. And what I told people is I said, look, if you've got the red light at home, you have the red vibe in your home, use it. Get it out of the closet, wherever it is, and use it. And I had somebody today that said, I watched your video and you said, get it out, use it. And now they're using it and they're starting to see the benefit. I'm like, it doesn't do you any good when it's unplugged and off.
Yeah, it doesn't. No, it's kind of like brushing your teeth, just having, whether it's a low end or high end toothbrush that sits there, but if you don't ever use it, you're going to have some dental problems.
Exactly.
Not going to do you any good. So, do you get pushback? When you introduce this to someone when they come, is it their trust in you because they know what you're going to offer? Is that what, just they'll do exactly what you're prescribing? Or do you get people to hesitate a little bit and you have to explain a little bit more to get them over the hump? What do you usually experience?
Yeah, I mean, I think it's really variable depending on the patient. So, many of my patients have been with me a long time, so there's a built-in trust, so they know that when I'm saying something or telling them something, they get it and they're like, "Okay," and then it just becomes a matter of finances. Like, does this make sense financially for my family to invest in this, red light and red vibe product? And how is that going to benefit me over the long term? And what I try to explain to them is, you're going to be able to use this more frequently and get all the benefits of having that in your home than I could do here in the office. Even though I've been doing photobiomodulation, as I said, for 25 plus years, we've seen incredible results doing the photobiomodulation in the office for a whole host of conditions. But now what I tell them, I said, look, the beauty of this device is it's relatively affordable for most people, and it's something that you're gonna have for years to come, and you don't and you're gonna see the benefits over the long term, and so it's more convenient, it's just a better all around, all around there's a better therapeutic application because the frequency, and also the benefits from the circadian rhythm are there that they wouldn't be able to get in my office.
Sure. And when you look at other ways to that you're treating them and using this as an adjunct, um, are you saying that would you agree that this drastically enhances all the other treatment sort of modalities that you might inter put together for a certain treatment? Like, how does that work?
Yeah, no, that's a very good question. Absolutely. It depends on what I'm doing. I mean, if, for example, the couple that I had in today that I was talking about, the gentleman, he struggles with sleep. And I said, this could hopefully benefit you and help you get to sleep and stay asleep longer and have a more restful night of sleep. That will that will actually assist with your ability to reduce supplementation or medication if they're on medication in order to get better sleep. And he was struggling with some patellar tendonitis. I said, this is a easy application for direct therapy. So there's this benefit, and now he's having pain with his knee replacement on the right side. I said, this will also help. So you're going to be able to see benefit, at home, and it's going to enhance everything else that I'm doing to help him. We're doing PRF. I'm doing PRP treatments of his left knee. His right knee's already been replaced. And the red light's going to help not only the regenerative therapies that I'm doing for him, but it's also going to help him with all the other maladies that he's struggling with.
Do you have patients who maybe they're using it one way at home, maybe say, for example, a knee issue, but they come back in for something else because you have patients who are constantly coming back to you. Does it occur to them to use RedVive for something else? Or once they come back in, and you sort of bring that up to them, they have an aha moment and say, wow, you know what? I didn't really think about it using it for something else that I have. I mean, does that ever happen? Or is it pretty much once somebody has it, they've got the hang of it and they know exactly how to use it for other things that they may experience in their health?
Yeah, I mean, I think it's there's a lot of different people, there's people that experiment and will utilize it in ways that, they're kind of just figuring things out as they go along, like, oh, that really helps me. And then there's other people that want my direction. They want to make sure that they're doing it properly. So they want to come in and talk to me and say, hey, can I do it for this? So a few weeks ago, we actually put out a few videos, and I basically did, sort of a how to, like, how do you turn this on? And then I went through all the benefits of the red light. And so I refer my patients to the video because, obviously I'm saying the same thing saying the same thing over and over again,
Mm.
but I'm trying to help them understand that you have this tool, it's not going to hurt you, and it can only help you. So you just have to apply it in these ways, and these are the safe ways to apply it, and this is the best way to do it. So
Mm.
the video was designed to help them, it was designed to help reduce questions, but also to enhance their ability to apply it into their own daily life.
I'm gonna have to go watch your videos. I have your website pulled up right now. But I'm gonna have to go
Right.
check out check out the videos, um, because it sounds like you're doing quite a bit of education through that to some of your to your community and to your patients. Um, what you something that I often talk about, and it was because of you, is the case study around endometriosis that you talked about in the last interview. Since then, what else? What are some other sort of really surprising cases or things have you seen um, that are maybe on the same sort of level or trajectory? Like, what comes to mind?
Well, I mean, that's still one of the most dramatic. And we did get a really nice testimonial from the patient, and it is on the website. You can check it out. Um, you know, I've used it for, I'm trying to think. I mean, that was like, to me, was so surprising. And now what that actually allowed me to do was to say, whoa, this is a surprise to me. So therefore, anything that's any type of chronic pain condition, this would be a usable tool in order to reduce their pain and help, reduce the inflammation. So I don't have another good example. I mean, that was like just, the kind of the pinnacle of many of the cases that I've seen. But with that experience, I've told people that live in chronic pain, this is something that could be beneficial.
Mhm.
And so, there's a number of people that are using it currently, and I haven't necessarily seen them back to kind of follow up and see how they're doing, but, we continue to use it basically every single day with all of our pa or with many of our patients.
No, that it sounds like that was a real big door opener, one for you from a confidence standpoint, like, wow, if can work for this, it can work for so many other things. So that must have been giving you some, you know, confidence and sort of motivation to really put this in front of as many patients as possible because, gosh, what other ways can you impact people's lives with it?
Exactly. I mean, you just think about people that are suffering with chronic pain and they're looking for solutions. And this is such a simple thing that doesn't require injections, doesn't require taking, type of medication, and yet they're getting good relief. So
Mhm.
I continue just to sort of ride, kind of that wave in terms
Yeah.
of, wow, if somebody has chronic pain of this degree, well, I think, back pain, knee pain, any other condition could be potentially beneficial. So it's an easy, way to explain to patients that there are all of these benefits, and so they should consider it.
So chronic pain is one of them. What are some other treatments or things that people have been coming in for that they've been complaining about that you would say, hey, if when somebody's watching this and and hear this, um, name some other things that what would I be feeling right now? Where when I come in, I can expect to be introduced to photobiomodulation, to red light therapy, and what it could do for me.
I mean, the other big thing that most people experience is an increase in energy. And
Mm.
that's what I was saying. I start my day with a red light, not just indirect for the circadian rhythm aspect of it, but also direct to help increase the mitochondrial production of ATP.
Mhm.
What do we all need today? More energy, right? I mean, who says give me, less energy. Everybody wants more energy, right?
Yeah.
So the red light will actually stimulate the mitochondria to increase energy. And what else do we need? We need energy for cellular repair. If we don't have the ATP and the medium of energy to actually help those cells repair, whether we've had an injury or we're suffering from, whatever condition we may be struggling with, we need that ATP in order for cellular repair to occur. Without it, we basically can't, move forward. And so I'd say energy is probably the second biggest thing in
Mm.
it, besides pain and inflammation.
So someone who is feeling low energy, lethargic, um, could would you say could it be? What are some of the reasons that people are feeling low energy? That if they were to start, wow, I'm feeling this way, and this could really be something for me. Um, what is that? What causes that?
Well, I mean, it's a variety of things that actually drive that, kind of mitochondrial dysfunction. And it could be anything from, viral infections, chronic viral infections. I mean, those are probably some of the big factors. Any kind of toxic load that we're experiencing is going to affect our mitochondria and energy production. So, and also reduce our ability to repair and heal. So I'm not saying that it directly impacts, sort of detoxification, but it can impact the ability, of our body to move lymph and to increase blood flow, which is actually going to help, get rid of these toxins and other things that could be affecting it. I mean, I've used it for even acute sinusitis, infections, upper respiratory tract infections, oral infections, throat infections. I actually have the patient open their mouth and put the red light directly into their mouth
Mm,
for those conditions. So, that's those are just a few things that actually can be affected in a positive way with the red light, and then and we
yeah.
use the near infrared.
And what are those, what's the benefits? People are getting sick right now. We've had a household over the last week that have been fighting. Who knows if it was flu, if it was COVID, what it was. Fortunately, my son and I, we, we, we were okay. But, and I use red light every day, so I'm just curious from an immunity standpoint, it sounds like there's some correlation between that and immunity. Is that what I'm hearing?
Yeah, so I mean, it's definitely going to improve lymphatic circulation. So, our lymphatic system is really how our body gets rid of some of those toxins. And that's where, our immune cells are actually binding to these viruses and then excreting them and eliminating those through our spleen and through the lymphatic system. So, the red light's going to enhance our lymphatic circulation. So that's what I was saying about sinusitis. And
Okay.
then, particularly you want to have it over your chest if you have the larger unit, because your thoracic ducts actually live right here, just under the clavicle, just under your collarbone. You put that up there. That's going to actually enhance the drainage of the lymph system, which is actually going to help clear these infections. So when I first one of the first applications of photobiomodulation was actually for lymphatic therapy, and
Mm,
we used it for acute and chronic sinusitis. We used it for sore throat from a variety of conditions, ear infections, things like that. Even lymph node swelling, we would apply it right to the area, and people feel better quickly. And um, so your family, hopefully you get them on there, but, I don't know how old they are, but, sometimes the teenagers can be a little stubborn.
6 year old,
Well, that's easy.
3 year old. Yeah, they get underneath it, but they usually use it for nighttime. It's part of their nighttime routine, and they fall asleep relatively quickly. Just when it's on and illuminating in the room, it's it's quite powerful that way.
Yeah, but if they get an ear infection, you can just apply it to the ear or their throat, put it over
Mhm.
their throat and just kind of over their whole, face and sinus area
Right,
too.
and it works the same way with adults, huh?
Absolutely.
Yeah. Um, so your staff, you have a lot of staff members that use this on a regular basis, just like you, or how are they? What do they think of this?
Yeah, my staff, I mean, many of my staff have been with me a long time. So they're used to, all the different things that we do. We introduce a lot of different things in the office. They benefit from it. And some of them use it more than others, obviously. And but I mean, it's pretty neat to watch because I don't really have many staff members that call in sick, because
Mm,
they take advantage of all the various tools that we have in the office. And, I mean, we're fortunate that way because we're a small office. There's only nine people. So if you're missing one person, I mean, that's, 15% of the workforce, so.
right. So I'm a new patient. I come in, and kind of walk me through the process. I'm really curious. How does it work? Who do I interface with? When do I see you? And through that sort of journey, when would I get exposed to um, photobiomodulation, RedVive, and all of that?
So we're the process of actually becoming a patient within my office is a little more um I would say it's just a little bit more involved, because we're a part, we partner with our patients. It's not patients just come in, they want a quick fix, they want this, that, or the other thing. That's not really the place for them, they really need to go somewhere where they're just going to get a prescription. So when people come to our office, they already have the understanding that they're going to get a nutrition, they're going to get a nutrition plan. They're going to meet with our lifestyle coach. They're going to have a whole set of um, interventions, lifestyle interventions to actually help them on their health journey.
Right.
And so by the time they get to me, I do the heavy lift with the diagnostics. I do the deep dive into trying to figure out whatever is causing their particular ailment, do the testing, do the analysis, and then create a treatment plan. Red light or photobiomodulation might be a part of that. That usually comes a little bit later in the process, but that's how we start. And what that does is it actually just helps lay that foundation because I need people I need people to really be in a healthy place in order to fully benefit from everything we're doing. And so that starts with nutrition. I mean, and other lifestyle modifications, including exercise and all of those things. So we're the approach is very comprehensive, and photobiomodulation is just another tool that we use in addition to all the other things that we do.
So I come in, you'll address my nutrition and exercise, maybe one of the first things because that's foundational to my health. Uh, then what comes next? What else would I experience? Other tools and how does that um, kind of flow? Before I get to something like a RedVive or even something else. I'm just really I'm interested in knowing what that journey looks like.
Yeah, I mean, it's probably a few months before we would, maybe introduce the biomodulation. It just depends on their condition, but we're going to start with those foundational tools: diet, exercise, supplementation, and then
Yeah.
we may introduce peptide therapy. We may introduce IV nutritional support. We may introduce just a variety of IV chelation, other things we do. It just depends on the individual. And then, I would say probably, you know, 3 to 6 months into it, depends on what their condition is too. So some people come directly for regenerative therapies. If they come directly through kind of another arm within the clinic just for regenerative therapies, regenerative orthopedics, and musculoskeletal issues, they're going to be introduced to the RedVive immediately because they're going to get they're going to get it either before the treatment, after the treatment. So they're introduced much earlier. Many of our other patients who are more, there's a lot of conditions that I treat, chronic fatigue and things like that. They're going to get it maybe a little bit later in the process because they have so many other things that we have to work on first.
Got it.
But eventually, once they're established, they're going to get exposure.
And when do they get exposed? You said a little bit before and then you said after. So in the clinic, that's where they're actually also exposed to it. Uh, when, what is it before? What does before look like and what does after look like in the clinic setting? What's happening in between?
Well, so you mean in terms of when they're exposed to
Yeah.
the photobiomodulation?
Because you said peptides. I know you're doing stem cell stuff. So are you doing preconditioning or is there in the workflow, do they get exposed to it and then do you do an injection after that? Or are they are they under the red vibe after an injection? So when does that take place in the clinic?
Yeah, so it depends on the individual, but we try to get them, kind of pre-treated before we do before we do the injections. And then they'll get exposed after we do the treatment. So we have protocols for, sort of that regenerative piece. And
Okay.
that's a little different than sort of our general, kind of patient who's doing, they've got other things going on. But
Mhm.
for the regenerative piece, it's we incorporate that before, kind of during and after the procedures are done to enhance what we're doing.
Got it. I, uh, I mean, I've heard the use of this at home weeks before being treated, as a preconditioning protocol, before the treatment. Is that something that is happening with your patients as well? Or is it more, are they coming into the clinic, getting exposed to it prior, a couple weeks or whenever prior to the treatment?
Yeah, so we're in the process of kind of finalizing and or sort of formalizing all those treatments, kind of to have that before and after treatment, so they're getting the advantage of doing their red light at home and then coming in and do the procedure, and then they're doing that at home. So that's something that we just rolled out in
Okay.
2026. So we have kind of the protocols, but also we have sort of the you know the I don't know, just the whole process for the patient to understand, look, this isn't just about you coming in and me doing an injection on your shoulder.
Mhm.
We want to make sure that you're getting maximal benefit and all of that. So those patients that are really interested, are they're engaging with that, protocol. And then other people are like, just inject my knee. And everybody's different, right? I
Yeah.
mean, so we kind of just beat everybody where they are.
Yeah. Have you had anyone just lean into it? From so you said you just rolled it out. So has anybody started that, or is this just something very new that people are going to start finding out about?
Yeah. Sorry, my dog's barking. My wife just got home. Wait till she gets in the house.
Yeah, that's okay. That's what editing is for. So we can.
Right. Um, what's that? Um, yeah, so, basically, so what I did is I created a whole package. So we have a
Okay.
program. And with that program, we have, sort of this is, the kind of the best case scenario is that you're going to do the red light, you do IV therapy, and then you're going to come in for the regenerative injection, whatever,
Mm.
So, um, and then we have the post, procedure protocol. So we have sort of, packages built out because some people are going to say, I want to do everything I can to get my knee in shape.
Yeah.
Other people are going to say, just inject me and let's see what happens. And, honestly, I mean, I get excellent results, with the injections themselves, but we get better results when we're doing all, supplementation, diet, red
Yeah.
light, IV, all those things. Those people are going to see much more benefit than the individuals who are just going just straight to the injection.
I like that you're packaging this because as a patient, I don't know what's going to be good for me. I don't know you know, I don't know how to put that together. But if you're bringing the best in class of things that are going to be useful to me, and they all are going to work synergistically with each other to maximize my performance, my benefit, my healing, then that's fantastic. I mean, was that what was the shift? What was um, the shift you made to offer this? It sounds pretty awesome.
Well, I'm going to give credit to Dr. Baumgartner because he's the master. He's so good. And I spent time in his clinic, and he had kind of different levels, and they start out with different things. Now my practice, I mean, we are non-insurance based, so
Right.
that discussion, about insurance, non-insurance never really comes up. So then it's just a matter of, well, we can add these things, to your treatment to enhance what you're doing already. And to be honest with you, you know, insurance is not really the end all be all that, some people think it is because, they're getting very limited exposure to all the things that could help them heal. And that's part of the reason that we elected to, basically, I haven't filed insurance actually in 25 years or, pretty much ever, because I never wanted the insurance company to decide what was best for the patient. What I consider to be best for the patient is based on the research that I do, the science and understanding that I have. with their particular condition. And, so it's kind of a no-brainer in a way because, I don't use my insurance at all. I mean, I've never collected anything from my insurance over years because I choose to do X, Y, and Z. And most of that I'm doing engaged with, is outside of that realm. And I think now that people are seeing very high deductibles, they're all kind of figuring out, well, okay, my insurance will cover this, but not that. So would you rather go for a steroid injection of your knee or would you rather go for injection of PRP? And okay, the steroid might be covered, but what are the long-term risks of that injection? And, people, once they become educated, they're going to realize I don't know that I wanna bear that cost of the long-term consequence of putting steroids in my knee because that might actually cause or might have detrimental effects, and I would rather go right for a regenerative therapy that's actually gonna enhance my healing even if I have to pay out of pocket.
There are so many more there's so many things that people in general don't know that's possible when it comes to regenerative medicine. It's such an exciting field because we're just not conditioned to uh, that our bodies are capable of healing, and and because we've been conditioned with symptomatic treatments, we're always trying to fix things at the not at the root cause. It's at, oh, I've got pain here. Okay, well, let's do something with it. Oh, why don't you take some ibuprofen? And but what's the underlying issue for why the pain is being caused in the first place? That's that's not something that we're conditioned.
No, absolutely. And I think it's gotta change because I think, one is healthcare has gotten so expensive, and even, with the deductibles, I think people are realizing, hey, I gotta take charge of my own health. And that's what this is all about. And this discussion is really all about is, let's take charge. What can I do for myself? How can I take care of myself at home? And what are the things and what are the tools that I can utilize in order to make myself, healthy and live longer and not swallow a pill. I mean, there's risk of taking ibuprofen, there's risk of taking Tylenol. All those things have risks. I'd say the risk of red light or photobiomodulation is very, very low.
Yeah, and the rewards are very high, especially at an ongoing, you know, the ongoing benefits. There's so much that it's like a Swiss Army knife for health. Is when you're using it that way. When when patients come in, when they get exposed to it, you do you find is it is it your staff that speaks to the benefits of RedVive to your patients? A lot of times, is it directly from you, or I'm curious if other individual stories take place, when they're interacting with your patients.
Yeah, that's a good question. So I would say that I do most of the kind of most of the recommendations and explaining to the patients, one, how it's going to be beneficial. And then, then I have the protocols for them. But like I said, I develop the videos. And then my staff actually will, sometimes show them the red light. They'll turn it on. Sometimes, they'll, turn it on for 10 minutes while they're if I'm running behind, they'll what we have units set up in all the exam rooms. So
Hmm.
then we'll turn it on. They can just experience the red light for 10 minutes while they're waiting for me. Then they're not thinking about the time that that I'm running behind, which helps. But then
Yeah.
they experience that red light. Or sometimes if, I'll just turn it on in the room and just have it, on. And then they get to see that. And that's powerful because then they say, "Whoa, they can feel that, they experience that." And then they're like, "Well, that's, it's different than when you're looking at something, on a computer screen going, oh, should I wear that red light or this red light?" And you don't have any sense of the power of that device.
Yeah, no, I completely agree with you, and I'm intrigued by that because experiencing it is everything. And so when you turn it on and you shine it, what's usually the first reaction that you get? Is it, do they shut their eyes? Is it too bright? Is it something that they're like they lean into? What usually is, what do you see?
Well, it depends on the person. I mean, some people are like, "Whoa," like they turn away because it is pretty bright, and then other people are like, "Wow, that's pretty incredible." It's like somebody just turned the sun, somebody just brought the sun into the room,
Yeah.
and
Is it the small one or the big one that you're doing?
I just have the little one on the desktop, so then I
Okay.
can just I've got it facing, I have like I said, I have one in every room, so then I can turn the power on, and then I just have it shine on the wall or whatever, and
Yeah.
then they can just experience that, and they can still talk to me while while the red light's on.
So when they then when you have them experience it and they put it on, what what's one of the most common things people are feeling, and what's usually getting them to be intrigued by this?
I mean, I think, it's kind of hard to explain, but they feel the energy of that light, on them, and they have a sense that that something is happening. They don't really know exactly what is happening. But I have some people that now they know that it's there. If they're waiting for me, they'll just turn it on and they'll
Okay.
just get a little mini treatment while they're waiting for me.
Oh, that's good. Well, those are, uh, that's a good thing, you know? One, it's attracting people to it, and, there's a benefit.
Exactly. Yeah, it's kind of funny. Sometimes I'll walk in and they just turned it on themselves. They figured it out. And so
So those people ended up taking it home?
I mean, a lot of those people do because once they experience it, then it's kind of they're just like, wow, this is something that and they know that I obviously they trust me and I've talked, through it with them, like what are you going how are you gonna use this? What are the benefits? That kind of thing.
Cool. Well, I mean, any other any other case studies that come to mind? I mean, you've covered chronic pain, low energy, um, you know, when people have infections, that this is something that that can be used. You've had people open their mouth for, um, for what is it? Oral mucosite? Was it oral mucosite?
Well, no, I've
Or
had them, whether they have any kind of like sore
oral?
throat, any kind of
Okay.
infection, or even if they have yeast overgrowth in their mouth, actually they can open that and that red light will actually help reduce the yeast too. I would say circulation is probably another big category. So
Okay.
having people apply it to their lower extremities or their upper extremities, depending. So that's going to help, enhance circulation. I haven't used it specifically for like Raynaud's and other autoimmune conditions that cause, some decreased circulation, but that would be a great application as well. Actually, well, that's not true. My sister, she's got lupus, and so she has a lot of circulatory problems.
Mm.
She got one, and so she's been getting under the red light and experiencing improvement in her circulation. It's too early to tell, long term, but benefit. But I'd say that would be another big category that we could consider. And then anybody who has, lymphedema, any kind of lymphatic issues, swelling, that kind of thing, you're going to see the benefit with the red light.
Have you seen any benefit? Have you started using the hat yet? The halo.
Yeah, as a matter of fact, I used it earlier. I was gonna put it on for the interview, but I already used it. I can't say my hair's growing, but it's
Got a
my
lot of
hair's
hair.
pretty good. So
It, what have you experienced with the halo?
I mean, it's very relaxing to me. I mean, I just got it like a week ago. I think Rusty sent it to me, probably
Cool.
about 10 days ago. So I've just started to play with it, but I was gone. Oh, I was gone for a few days and my kids all used it while I was gone. That was pretty funny. I'm like, here's how you charge it. And they all took turns wearing it. So
That's cool. Yeah, I'd be interested in hearing what comes of that too, because that should provide some other benefits as well. I've heard everything from increased energy to just more focus, cognitive. And I know it supports a lot of brain health. Raves about that. So uh, I'm curious to hear, more of Headaches. I know headaches have been something that I've heard benefits. People headaches go away after migraines. So I'm sure there'll be plenty more. And I think uh, Rusty's had some potential hair growth. He had a photograph that he sent us that before and after, and he asked ChatGPT, like, "Can you tell me the difference between these two photographs?" And the after photograph seemed promising. So yes,
That's great. I
we're
love
still
it. I
we're
love it.
still
Well,
we're still
I'm just
collecting.
getting started, so we'll see what happens.
Yeah, that'd be great. Well, this has been helpful. I mean, are there any questions that I have not asked you that you would have loved to, talk about, or what you want to say? Because you have so
No, I mean, I think, I think the biggest thing is I think that a lot of physicians might not I think they might struggle with how they would introduce it to their patients. And I think I'm hoping that maybe with this interview that some of the doctors out there that have been exposed to it over or through conferences and things like that, and maybe using it personally, but haven't taken the leap to actually start to have their patients use it, would actually see this and say, hey, this is something that my patients could actually really benefit from. That's what I'm hopeful for because, honestly, I think if everyone could have it in their home, even a small unit, I think the benefits are so great. And actually, the other day, my neighbor, he has a herniated disc. Kind of, he was chopping wood, and then he was shoveling snow, and just kind of being not the wisest 60-year-old guy. So, so he's had this back pain, and we're good friends. I'm like, Dan, I'm bringing over the red light, and he's not really a huge believer, and he just does. I don't know that he gets really what I do, but I'm like, just try it. So I set it up for him, got him on it, and then he did it for a few days, and his pain actually started to get better. And he's like, yeah. So I stopped by, and he's like, yeah, I didn't do it yesterday. I had a little flare, so I don't know if it was coincidental, but so I'm making a believer out of my neighbor slowly, but like I said, it'd be great if everybody had it in their home, even a small unit, for all those things that they can use it for. And I think the doctors that have been exposed, and Dr. Desai obviously is passionate, and he's
yeah,
given great lectures and shown the science behind it. And I just don't know how many of the docs kind of embrace it, and but it was easy for me because what I tell my patients, look, I've been doing photobiomodulation for 25 years.
yeah,
I've got, if you walk through my office, I mean, right now, I probably have at least 8 devices in my office that deliver different types of PBM.
sure.
And so I tell my patients, look, this is something that you could actually own and take home versus, I've got one unit that comes from Switzerland. I mean, it's like buying a new car. You can't have a car in your living room necessarily. It's only really made for clinics like mine. And so this is a great tool.
Yeah. What do you think about uh, prevention? I mean, I know there's so much use of this for after the fact. You've got pain, and somebody has some issue and challenges that they're using it for. But how do you think about this for preventative? What are things that you might see today that if somebody was to start using this may be able to prevent some, potential health challenges, if any?
Yeah. Well, what I said earlier about cellular repair is really the biggest thing. If we can increase ATP production and we can repair cells, we can prevent a lot of disease. That's the bottom line. So, you know, anytime I talk about mitochondria and mitochondrial function and energy every single day with all of my patients. And people, they don't know, some people know what mitochondria are because they remember from biology, but our mitochondria are so affected by our environment and all the things that we're exposed to. Anything we can do to enhance mitochondrial function and number is is a win because that's prevention, because you're going to get energy in order to detoxify, make energy to help repair. All those things are critical. So I'd say, red light for ATP production is one of the best preventative tools we have out there.
Well, on that note, thank you so much, Dr. Logan. This was wonderful. This will be very
Great.
helpful to a lot of people. Uh,
And I'll be keeping my eye out for some of those sort of awe-inspiring cases, as we continue down this journey, and then I'll
yeah.
just kind of record those and then we can get back together and do it again.
Oh, that'd be great. Thank you so much.